All right, good morning. We're going to get started. So welcome to the Department of Medicine Grand Rounds and our yearly Women in Medicine Grand Rounds. This week was International Women's Day, so it's perfect timing for this type of talk. So this Grand Rounds is intended to celebrate our diversity by recognizing the unique and significant contributions of women in medicine. It is to give a formal platform to everyone from all walks of life to learn and be inspired by this diversity. With that, it is with great excitement that I would like to introduce Dr. Margaret Passani. Dr. Passani is a professor of medicine at Yale University School of Medicine in the Division of Pulmonary, Critical Care, and Sleep Medicine. She is the Vice Chief for Faculty Mentoring and Career Development. She earned her Bachelor of Science degree in physics from Iona College, a Master of Science in Biomedical Engineering from NJIT, MD from Temple University, and MPH from Yale University. Dr. Passani completed her internship, residency, chief residency, and fellowship all at Yale. She remained there as faculty and had been the fellowship director for 10 years and has an extensive track record for mentoring medical students, residents, fellows, and junior faculty. She is the vice chair for the Women in Pulmonary Group for the Chest Foundation, and she is the chair of the Faculty Advisory Council to the Dean at Yale. Her clinical and research interests include sleep, delirium, and circadian biology in critical illness, functional and cognitive outcomes in older patients after critical illness, and aging and lung disease. She has also led the COVID-19 clinical response for pulmonary and critical care at Yale School of Medicine. Please join me in welcoming Dr. Passani.
Thank you, Dr. Shaw, for that really warm welcome. You make me sound really good. I'm really excited to be here today, and I want to thank Dr. Sethi for inviting me to do this as well. And so today I'm going to talk to you about advancing careers, the importance of mentorship and sponsorship. And as Dr. Shah said, it's Women's History Month, and so a quote from one of my inspirational women: "Women belong in all places where decisions are being made. It shouldn't be that women are the exception." And so here's an outline of where we're going today. I want to talk to you about the differences between mentorship and sponsorship, what some of the mentoring data tells us, talk a little bit about the different types of mentoring that are available, how to be a better mentor-mentee, and share some of my personal experiences. So there was an article by Bates in 2016 that examined factors they felt were necessary for achieving equity in medicine. They talked about the importance of salary equity, equity issues related to research funding, reviewing the data that fewer women and minorities receive NIH funding. They also highlighted the importance of mentorship and sponsorship if we are going to achieve equity. And lastly, they focused on recruitment and retention of women and minorities. Today, my talk is focused on mentorship and sponsorship, and I will share the data about its importance in recruitment and retention as well. So I happen to be a little bit of a Greek mythology geek, and so a little bit of history about where Mentor comes from. So the story of Mentor comes from Homer's Odyssey. Odysseus, the king of Ithaca, fights in the Trojan War and entrusts the care of his household to Mentor, who serves as teacher and overseer of Odysseus' son, Telemachus. What I don't know if everybody realizes is that actually Athena, the goddess of wisdom, courage, and inspiration, is the one who takes the form of mentor and advises Telemachus. And so truly in this mythology, the mentor was a woman. And so mentor, the definition is someone who imparts wisdom and knowledge. So this is data. When I was thinking about putting together this talk, I started with a PubMed search and I put in a keyword mentoring. And so it was interesting to me that if you look at the numbers of articles related to mentoring, the first article was published in 1912, and there was barely any other articles again until 1962. And you can see it was pretty flat with minimal articles every year until the late 80s, early 90s, where the number of articles pertaining to mentoring began to increase and take off exponentially. So I put this question in here to get us thinking, because the idea that the term mentoring may be flawed has been raised recently. And I think this is because the term often means different things to different people, and the definition varies from study to study. People are often confused mentoring with coaching, and there are many different techniques for mentoring, as we'll see. I think of what we often think of in medicine relates to my second statement on the slide. The focus of mentoring becomes about connecting with the other person instead of identifying what their needs are and trying to find the best mechanism to address those needs. And so I want to keep that in mind. And this kind of theme will come up as we talk about mentoring and the importance of mentoring and how to be a mentor. So types of mentoring programs, as I mentioned, there are different types. And the traditional one that most of us are familiar with is what's called the dyad. So this traditional one-on-one mentoring, you're assigned a person, they're responsible for you, you're the mentee, they're the mentor. But there are other kinds of mentoring relationships that are found in the literature. One that has gained more popularity recently is peer mentoring, which is mentoring that's related to emotional support. It's there to foster collaboration. And you find this especially among younger cohorts. Functional mentoring is guidance for a defined project. So if you are doing research similar to me, you may come to me and say, can you help mentor me on this research project? Speed mentoring is designed to answer specific questions you may have. And then group mentoring really is a way to connect trainees. And you'll often find this in mentoring literature related to medical students. And then there's this idea of distance mentoring, and this kind of maybe where it overlaps with sponsorship, and we'll talk about this, but distance mentoring may actually be important for helping advance careers. So either you're involved in a multi-center trial or a cohort of things looking at something related to education with a group of people around the country, and someone at a different institution may be helping with the project or helping you with your career. This is another classification of mentoring types which are found in the literature, and you can see there's overlap here with the previous slide. But here we also have mentoring styles that focus on diversity, where one intentionally includes mixed demographics and interests, and research demonstrates that this diversity increases creativity and problem solving. So this becomes important when we're trying to, and this has been shown in the business world, having diverse teams and diverse mentoring teams leads to better outcomes, leads to more creative ideas. Multi-level mentoring is important, especially in large organizations, because it helps groom future leaders in the organization. When using multi-level mentoring, one needs to ensure, again, ethnic and gender diversity, especially in junior members, because this will become important to reducing what people have described as the leaky pipeline that keeps minorities and women from attaining top leadership positions. And then a positive of the pandemic and the widespread use of Zoom is the increase of electronic mentoring, which allows junior people more access to senior people outside of their own institutions. So there are phases to every mentoring relationship, and this is most common with dyad relationships, but can also occur with other peer or group mentoring. So the initiation phase involves, when you start to engage to assess the possibility of a productive mentor-mentee match. May be kind of similar to dating. You're kind of meeting people, trying things out, seeing who you may be able to work best with, who can help you the best with what your ideas are, what your career goals are. And then cultivation is the most intensive and sustained phase in the mentoring-mentee relationship, and is where the key mentoring functions occur. This is where you kind of work on your career development. It's during this phase that the mentor-mentee engagement peaks. And then there becomes a separation phase, and the nature and the intensity of the mentor-mentee relationship shifts. There may be role alterations, interactions between mentor and mentee may decrease. The mentee becomes more autonomous. And in research, this may be when your mentee gets their R01 funding. And this is the phase sometimes where things start to get a little tricky between mentor and mentee, but it's an important phase for mentees to grow, for them to be able to get the things they need to be promoted. And then in the redefinition phase, the relationship kind of has run its course and may shift into a collegial friendship. There may be peer bonds, informal contact, and mutual support at this stage. So this is data from a social media survey of 138 respondents, which asked the question, what one word best describes what you are looking for in a mentor? And you can see the thing that came out the most was patience, right? And so we need to remember this as we engage as mentors, that people we're working with may be struggling. They have questions that we may know the answers to that they may not, and we need to be patient with them. Other things that were important were honesty, the ability to really listen, being supportive, encouraging, transparent. And so these were things to think about as you're being in a role as a mentor. This same survey identified themes. So there was a part of it that was qualitative that said, what are the things that you see in a good mentor? And so the themes that came out were that a good mentor doesn't assume something is understood or obvious. So they take the time to really explain things, make sure the mentee understands what they're talking about. When something is out of the mentor's scope, they find someone else to help them. So if you came to me with a question on how to make a transgenic mouse model, I would try to find someone clearly that's outside of my scope that could help you with that. A good mentor has not forgotten how it feels to be new, to be afraid, to be ambitious. And then again, back to that theme I raised on that one of the first slides, that a good mentor provides advice that is best for the mentee to support the mentee's goals. There are several studies which have tried to examine the mentoring experience of those who are underrepresented in medicine. And what the data shows is there's a lack of experienced senior mentors with extensive professional networks to support these individuals in career development. Due to lack of mentoring and sponsorship, they then have difficulty establishing national reputations that are needed for promotions and for leadership roles. They tend to rely more on peer mentoring, which, while important, often may not lead to the same opportunities as having senior mentors. And so at Yale, there's an organization called MORE, Minority Organization for Retention and Recruitment, whose focus it is to address these issues on a local level. They also work with the university to attempt to address pipeline issues by working with minority high school students, college students, medical students, and trainees to encourage careers in medicine for those who may not have considered it or may not have had the same exact academic resources. So again, realizing that, we need to start early on to encourage people to go into these careers to increase the pipeline moving forward. This is data that studied factors which contributed to burnout in internal medicine residents. And so they asked a whole bunch of questions about things related to emotional exhaustion, cynicism, and what they found, and there was a question about mentorship, and what they found was that when residents reported having strong mentorship, there was a correlation with reduced levels of emotional exhaustion and cynicism, and this was significant pretty much at all levels of postgraduate training. So again, the importance of mentorship in potentially reducing burnout for trainees. This study specifically examined general internal medicine clinician educators in an academic setting to understand where physicians were getting mentoring from. And so you can see from the graph that 43% of these clinician educators sought out their own mentors. And I think this is fairly common. Most of us, or oftentimes, will seek somebody out and ask, can you mentor me? We are interested in similar things. Can you give me advice? 20% had peer mentors and 21% had mentors outside their home institutions. Only 15% reported being assigned a mentor as part of a structured program at their institution. So I see this data as a call for improvement in institutions to develop structured mentoring programs for their physicians that, again, are individually customized to meet their career goals. The other thing we can also work on is formalizing peer mentoring, as this can be an important means for accountability and support. And so at an institutional level, really thinking about ways to formalize these mentoring relationships, setting plans in place to ensure that everybody has access to mentors, individual, group mentoring, peer mentoring, and that people don't fall through the cracks. This is that same study of clinician educators, which examined why people were meeting with their mentors. And these are pretty standard reasons, including project development, promotion, career plans, discussing opportunities. The one thing which I think is low at 7% is negotiating tactics. And I think we need to help junior and mid-career people learn what to ask for and how to negotiate for it. Again, this is especially important for women, as gender stereotypes and cultural norms have traditionally made them less adept at negotiating for what they need and negotiating for their own worth. And while this is, again, shown in an academic setting, there's data that supports this in the business world as well. So when looking at studies which have focused on women in mentoring, and this is pre-pandemic data, but insufficient mentoring is cited as one of the many reasons that there is underrepresentation of women in leadership positions. 13% of women faculty in these studies reported never having a mentor, and 34% reported having a prior mentor but didn't have one currently. So close to 50% of women were lacking mentorship or were having insufficient mentorship. And again, this is an area I think which needs to be actively addressed. And I don't have data in here because some of it is still coming out about COVID and what COVID has done, but there is some early data to show that COVID has had a large impact on women and women's career pathways. As far as they have had less research publications over this time compared to men, and they've had struggles with keeping their research projects going and getting grant funding. And, again, the reasons for that are multifactorial. But again, some of the data initially suggests that because they're also sharing lots of the work for caring for families and with kids being home from school, that has really impacted them as well. This is a cross-sectional survey study that examined factors which women felt would impact their decision to remain in academic medicine. And so the authors report results from 410 surveys and found that the things important to women were transparency of leave policies, work-life balance, having the presence of women role models in their institutions. And it also importantly, women who reported having peer mentorship had a significantly greater odds of remaining in academic medicine. So again, talking about the importance of mentorship in keeping women in jobs in academic medicine. This chart represents some of the data from the same ONUMA study, which again then asked participants to rate on a Likert scale what kinds of mentorship opportunities they had. And so the dark blue bars are for whether they had formal mentoring opportunities. And you can see a little bit over 50% agreed or strongly agreed that there were formal mentorship opportunities at their institutions. A little bit, around 50% again, felt that there was sufficient informal mentorship opportunities, but again, less than 50% were satisfied with the mentorship opportunities available. So we're still suggesting, or this data still suggests that close to half of women don't have formal mentorship opportunities, sufficient opportunities, or are satisfied with those opportunities. This is another thing that's potentially impacting mentoring, and especially mentoring for women. So with the advent of the Me Too and Time's Up movements addressing sexual misconduct in the workplace, concerns have been raised about the impact this may have on mentoring for women. Men report fear of false allegations that can compromise their careers. And this has serious consequences for women's career advancement in medicine, especially where female leaders are few. And so women represent 50% of medical school graduates, and only 16% of deans. So if women are denied mentorship and sponsorship by senior males, this can perpetuate this gender gap in career advancement and leadership. And so while these articles came out in 2018, people are still trying to look at this and looking at the importance of having men mentor women and its importance in promoting women in academic medicine. I want to spend a few minutes talking about sponsorship, because having access to sponsors is equally as important as having mentors. And so sponsorship is defined as public support by a powerful, influential person for the advancement and promotion of an individual within whom they see untapped or underappreciated leadership potential. And so what are the differences between mentors and sponsors? People can mentor at any stage of their career and do not need to be in a position of power. Mentors are often selected for their content expertise and often work behind the scenes in their mentoring roles. But sponsors should actually be highly placed in organizations and have influence over decisions and promotions. Sponsors should act as advocates for junior members. And while I think that sponsorship is getting more traction in the medical community, in a survey that looked at this, 42% of respondents didn't know the difference between mentorship and sponsorship. This slide actually depicts the overlap between mentoring and sponsorship. And so key things to point out here are that a mentor may also serve as a sponsor. So you can be both if you are in a position of power or a position where you can actually help advance the career of a mentee. Ideally, multiple mentors and sponsors are better for your career. So if you can find people that are willing to sponsor you, that's important for career development. And they both are key professional relationships. And while the focus tends to be on the mentee, or I don't know if the correct term is sponsoree, but the person who's being sponsored, actually there's data to show that mentors and sponsors also benefit from these relationships. So it's not just the mentee who benefits. The importance of sponsorship has long been recognized in business industries and is only more recently being the focus of discussion in medicine. These two books written by Sylvia Hewitt discuss the importance of sponsorship to career advancement. And similar to mentorship, women are sponsored much less frequently than men. And this is a contributor, again, to the gender gap seen in leadership in business, but also in medicine. This is data from a study of career development, and these people that were interviewed, and it was somewhat of a longitudinal study looking at people who received career development awards, so either K08 or K23 awards. And there were 966 participants at academic institutions. 46% of them were women, 71% were white, and the mean age was 43. And they examined individual measures of sponsorship and then a composite measure. And so you can see on the left side is their sponsorship composite measure, and then there are a bunch of individual things like whether you were an oral discussant or a panelist at a national meeting, whether you were on a study section or a national committee, were you ever invited to write an editorial or serve on an editorial board. And they looked at the data based on mentoring dyad. So whether you were a man who had a male mentor, a man with a female mentor, a woman with a male, and a woman with a female mentor. And for all combinations, men were sponsored more frequently than women. And so the p-values here represent the differences between men and women who had these NIH Career Development Awards. And these are after they adjusted for things in regression models, such as age, race, year of the award, things like medical schools, medical specialty, so some specialties more likely to potentially get awards. The funding institute, again, because certain funding institutes may have more money, and level of funding at the institution. And so even when men had female mentors, they were more likely to be sponsored than women. So why should we be sponsors? Well, there's some data that looks at the benefit of sponsorship to the sponsors. So in addition to personal satisfaction and watching a career development, being a successful sponsor gets one known as a person who has an eye for undiscovered talent. It's a two-way street, so the sponsor can benefit as much from the proteges in their proteges in a site, and also value the legacy of those who will lead their profession into the future. So it's kind of a way of giving back, and also you're setting up things to continue on into the future. And so that's thought about a lot in business, like succession plans, but much less so in medicine, I think. So here's Athena again. And so I just put this in here as my transition slide. So I want to kind of transition to think about what do I need to think about if I'm trying to be a mentor, or if I'm looking for a mentor, or if I'm going to be a mentor. So here are questions that everyone should ask when they're thinking about entering into a mentoring relationship. What do I need, and how can I get my needs met? And so I think understanding that and trying to be clear about that yourselves will help you then search out a mentor that's as appropriate for you as possible. And so when seeking out a mentor, I encourage you to think about these aspects of career development and what pieces are especially important to you. You will likely need multiple mentors and sponsors if you want to address all of these domains, but we'll talk about some of these individually. So professional development is the one we think about the most when we think about mentoring, and it can encompass a variety of things depending on your job, and may include some or all of these things. The things I often get asked about are time management, conflict resolution, as well as what kinds of things my mentee should say yes versus no to. Mentors can provide emotional support, and this is, again, important at all stages of career development. It's become even more important as we weather this pandemic. And this is a place where peer or group mentoring may also be beneficial. For junior people, specific areas to address where they may need more emotional support are transitioning from training, the stresses of taking on new responsibilities, and how to adjust to having less protection as they move up the career ladder. Mentors and institutional mentoring programs should provide a safe space. Again, this is important at all career stages, but especially during career transitions. Mentees should be allowed to discuss and process their unique and individual experiences and not be worried about being invalidated, devalued, or disrespected. So oftentimes people are fearful of asking questions or bringing up issues because of these issues of being, feeling that they're going to be invalidated. Mentoring is important for providing a sense of community. Again, especially important during the pandemic where we've been socially isolated and don't experience the casual water cooler conversations and lunchroom interactions. This is, again, where peer and group and remote mentoring may help us maintain a sense of community, but we need to be purposeful about making this happen. And you can see our thing has not been updated since the pandemic, but this is the group of people that I'm fortunate enough to work with and have been really fortunate to, as a fellowship director, work with amazing trainees. And you can see Dr. Maynardi in there in a couple of pictures, but really fortunate to have a sense of community in our program. Mentoring is also a good means for holding ourselves accountable. So mentors can help us set expectations and deadlines and hold us responsible for accomplishing what we set out to do. I find this especially helpful to have people establish writing groups. That's one of the things for me that I struggle with, is keeping to like tasks of like writing that are not things that actually need to be done at this moment. Like patient care is, you have to do it, you're doing it now, but things that can be done on off times are harder to keep, I think, on task. So writing groups are important to help people stay on task with their projects. But it's also important to keep people accountable in their research, administrative work, and educational initiatives as well. Role models are also important for us to have, and these are some of mine. They're successful at what they do for a multitude of reasons. They're successful in medical education, patient care research, and their mentorship and sponsorship and work-life balance. And so some of them are famous people and some of them are known to you. And most of that, except for the famous people, have been my colleagues at some point in time. The other thing that's really important for career development is access to networks. And there are many avenues to find mentors and sponsors through local and national networks. And so I've pictured just a few here. And so there's local ones here for all of you. But there are also, for those who are in pulmonary critical care, the American Thoracic Society, the American College of Chest Physicians Society for Critical Care Medicine. There's the American Medical Women's Association. And so all of them have different things that they offer for professional advancement and engagement. Both the ATS and ACCP have transition and training committees and have active junior career-oriented activities and events. So I've been fortunate to meet many amazing women through some of these mentoring programs. And so none of these women are at my institution. I would have never met them otherwise, but I met them through both the ACCP and ATS mentoring programs. And, I've learned from each of them. And it's been really, as talking about the rewarding part of being a mentor, it's been really rewarding to watch them remotely and watch their careers advance and catching up with them, and now catching up with them over Zoom. And so again, it's a plug for why it's important to be a mentor, and how being a mentor, you also gain. But one thing I need to remind myself when mentoring is that it's not about me. What worked for me as a mentee or worked for one mentee may not work for somebody else. The culture may be different. My mentee's goals may be different from my own. And so we need to remember to move the focus from ourselves to those we mentor. And I think sometimes where people struggle with this, and we find, I see it in my institution, is somewhat more in the research arena or in the basic sciences arena, where the mentors have trouble letting the mentees separate or go down their own pathways or choose their own research ideas, or just kind of letting them grow and focusing on what's important to them. So as I said earlier, you can be a mentor at any stage of your career. And here are some suggestions for becoming a better mentor. At early career stages, you can build mentoring skills by reading books, attending workshops, and getting advice from peers and senior mentors. And so students and postdocs function as mentors. They function as peer mentors. They function as, the residents function as mentors to the med students. And faculty can also use some of these same tactics to improve their mentoring skills. And so again, attending workshops, soliciting feedback about what you're doing well, what you can work to improve on. And then institutional leaders can provide training and professional development. And I think this is where it's key and what is lacking at most places, but creating a reward structure to recognize and value high quality mentoring. And this is where not the argument, but the questions come in about, well, if I'm devoting all this time to mentoring, it's not RVU based. How do I support my salary doing this? What kind of recognition or what kind of support do I get from this? You don't want people to use all of their own personal free time to do this mentoring. And so I think institutions need to recognize its value and come up with ways to support it. We had been toying with it pre-pandemic, and I actually don't know where it's landed now, but trying to develop some kind of an educational or mentoring RVU system so people could get credit for this time. But again, recognizing it ends up being complicated because you somehow need to track outcomes. And so this is something that I think it's important. I think it's in early stages. I haven't seen anyone that's had a good structure for this, but it's something we're thinking about. So I'm going to take a few minutes just to share some of my personal experiences. So this is Dr. Sharon Inouye. And so she's a world famous geriatrician who's a delirium expert. And so she developed the CAM, or the confusion assessment method for delirium detection. I don't know if you guys use the CAM here, but she is at Harvard now, but was at Yale when I was a fellow. And so I was interested in studying dementia and delirium in the ICU. At a time at Yale when everybody was a lab-based physician looking at transgenic mouse models and biologics of asthma. And so I was told at the time by my division chief, why do you care about confused old people in the ICU? And so I was like, I don't know, maybe someday if you were ever a confused old person in the ICU, you might be grateful I cared about it. But I was really lucky because I had support of other people in my division, and I don't have a picture up here, but Dr. Richard Mathey, who was one of the senior faculty, supported me in this and actually supported me to get a master's of public health because I didn't have any training into doing clinical outcomes research. But I knew that it was something I was interested in. I knew I didn't want to go into the lab. I'd been an engineer before. I had worked in a basic lab, and I was like, this is just not for me. And so I did get support for doing a master's of public health as part of my fellowship, but I went to Dr. Inouye, and at first she was like, oh, I don't know if I can help you. I don't know anything about the ICU. Yes, I know delirium. Write a proposal and come back to me. So I'm like, oh, okay, now I get to, come up with something good. And so it took a little while, but I finally did manage to persuade her to take me on as a mentee. But she was smart enough to know that she could mentor my project and could teach me about delirium, but that she couldn't sponsor, she could sponsor me in the geriatrics world, which she did. So she put my name in to give talks at the geriatrics meeting, but it wasn't as helpful for my career as a pulmonary critical care physician, right? It was nice to go to the geriatrics meetings, but I needed to get recognized in pulmonary critical care. And I was trying to do something at the time where everyone was like, who cares about delirium in the ICU? Nobody cared about it. And if you look at those PubMed graphs of like how many articles there are, when I started, there were like maybe 1 or 2 articles. And, now it's like totally escalated. But so because she was smart enough to know that she couldn't sponsor me in that world, she recruited Wes Ely at Vanderbilt to act as my sponsor, which he did. And so if you remember my descriptions of the phases of mentoring with like initiation, cultivation, separation, and redefinition, our relationship has really gone through those stages. And so, initiation was like a dance. We tried, I had to convince her that she should take me on and that it was going to be worth her time and that I would actually, come through. And this is important for the mentees to know. I was going to come through with what I promised to do. I was going to, meet deadlines. I was going to write when she asked me to write. I was going to, be diligent about, my project. And then, the cultivation stage was really important. And we spent a lot of time. And I remember getting back from her, my papers where it was like basically all red. And I was like, all right, where's the part I wrote in here? It's like all red. And, with a little note that red is love. But, she cared. She took the time to really read it and give me, good feedback. Right. And so, she was really invested as a mentor. And so we spent a lot of time. And then, unfortunately, she ended up leaving Yale. And so we had somewhat of a separation that was induced by her leaving Yale. But she still maintained her mentorship with me from a distance. So we had a distance mentoring relationship. And when I took my first sabbatical as an associate professor, I went up to Harvard and spent time at Harvard with her and her group. And then our relationship kind of was a little bit redefined, right? Because we were working now more as collaborators and doing things in parallel as opposed to mentor-mentee. And so our kind of relationship has gone through those phases. And now, I think we think of each other as colleagues. And so mentoring is good for the institutional soul. It creates an environment where lifelong learning and professional development are woven into the very fabric of the organization. None of us accomplishes great things alone. We all stand on the shoulders of many. And so I've really been fortunate to stand on the shoulders of many others over the course of my career. These three people who are pictured with me over here, I know you probably can't even tell that it's me. I look so different. Obviously, it was like when I was a chief resident, were my co-chief residents. And they were my first peer mentors. They taught me how to teach, how to be organized, how to make clinical schedules, which I unfortunately still have to do to this day. And then on the other very far right is Dr. Lynn Tanouye under the mask. And she was my first attending as an intern. She was my role model during residency. And one of the reasons I chose pulmonary critical care medicine. And actually, when you're saying, oh, when she was at Yale and she was at Yale and she was at Yale, I'm like thinking, oh God, I really have not gone anywhere, have I? But she really is one of the reasons I stayed at Yale for all these years. She's been an amazing mentor and during the pandemic, an invaluable colleague in working with me to figure out unique ways to staff our ICUs and care for the multitude of COVID patients we saw. So again, that relationship went from being teacher to mentor to colleague over the years. In the center picture is Erica Herzog, who's my assigned mentor at Yale. And she's actually a basic scientist. So what we do is very different from each other. She does IPF, basic science research, but has helped me stay on track with my career, for my promotion metrics, and has been an emotional support over the years. So a mentor is someone who sees more talent and ability with you than you see in yourself and helps bring it out of you. And so, again, I've been extremely fortunate to have mentors who do this. And as a mentor, it's extremely satisfying to watch your mentee succeed in all aspects of their lives, both professionally and personally. So being a mentor is a means of giving back, helping the next generation to be more successful than the prior one. Mentoring is a two-way street. I learn as much from them as they learn from me. And so this is definitely true for me. And I've learned so much from working from these amazing people in these photos. So down here on the left, all the way to the left of me is Dr. Lauren Ferranti. And she came to us from Columbia as a fellow and was interested in kind of a similar pathway to me. So it's easy to mentor someone who has a similar path to you. So she was interested in aging and geriatrics and outcomes, and has been co-mentored by myself and Tom Gill looking at functional decline using large data sets. And so before Lauren, I didn't know how to work with large data sets. I learned that from Lauren. And I've learned about frailty from Lauren. On the other side of me down there is Kasum Matthews, again, who was a fellow at Yale, who is now at Mount Sinai in New York. And Kasum's research was on flow through ICUs and how does flow from the ER to the ICU to the floor impact patient outcomes? How do we improve flow? Again, she did operational research and we partnered with the School of Management. And so again, from Kasum, I learned stuff I would have never known. Why is this important? What is, how to collaborate with colleagues inside the university, but outside of your department. Next, in that next picture is Terry Murphy. And Terry Murphy was actually my statistician, but he went from he was not on a ladder track pathway, but Yale then created this pathway where you can be on a ladder path as a PhD statistician. And so he decided to move to the latter path and now needed a mentor for that. And so we went from having this, I mean, our relationship didn't change, but we went from having this, he was my statistician, helped me with my statistics, to me mentoring him on some projects to allow him to be on the latter pathway at Yale. And so I learned a ton of statistics about him, about modeling, about imputing missing data. Next over is Drew Harris. And then I'll talk about Drew and Ann Maynardi, who you can see up in the corner with her ATS poster together, because Drew and Ann were together at Yale as fellows, and they are both such amazing people. And what they wanted to do, again, was something that nobody and none of our fellows had ever done. They wanted to look at social determinants of health, and they wanted to do something called, which I didn't know about till I learned it from them, community-based participatory research. And they really wanted to go out into the community and see what does the community need and how can we then help as the physicians in the academic center, instead of us as the physicians going into the community and saying, this is what we're going to do. And so they really have done this amazing work looking at disparities in asthma and things that are out in the community that maybe we can impact on. And they've looked at something called medical legal partnerships, and using these medical legal partnerships to impact patients with asthma. So if their asthma is flaring because they're in bad housing, holding the landlords accountable, or if they're having trouble, they're losing their job because they're missing days because their asthma's flaring, using attorneys to try to help with those kinds of things. And so again, really amazing and impressive research. And then all the way on the right side is Dr. Michael Perkins. And Michael came to us from Tufts as a pulmonary critical care fellow. And Michael was interested in machine learning. And so what we did was we took data from our EPIC database and again, partnered with people at the School of Management to do machine learning to look at, could we use the data in the medical record to predict who was going to decline from sepsis. Again, so something I had never done in my career. I knew nothing about machine learning. I knew nothing about how to code for this, and learned a ton of this through working with Michael. And then up there next to Ann is Melissa Knauert. And so Melissa was actually a Yale med student, went to Penn for fellowship, residency, came back to us for fellowship, had a PhD in molecular biology, started out in the lab, and was hating being in the lab. But, it was, again, people at Yale typically go into the lab, and came to me when I was the program director and said, I'm really miserable and I don't know what to do. And I said, I have this idea about sleep in the ICU. Do you have any interest in looking at this? And she's like, yeah, let me read about it, take a look at it. Maybe I could do it. She was, unhappy and wanted to try something else. And so she looked at it. We started some small projects, and now she's totally run with it. We're to the point of, she's got a career development award. She just put in 2 R1s, and she's looking at the importance of sleep and circadian biology and outcomes in critical illness. So looking at delirium and looking at other biologic outcomes. So again, someone who needed support, wanted a change, and needed someone to believe in her. And then the last people up there on that slide, one is Dr. Jackie Geer, who was a pulmonary critical care fellow with us, now is finishing up her sleep year, but again, was interested in obstructive sleep apnea and stroke and outcomes. And so we managed to find her partners with people in neurology that did stuff with intracranial hemorrhage and stroke, worked with sleep people, and set her up a mentorship team of people, sleep, pulmonary critical care, and neurology, so she could, explore what she wanted. And so those are just some examples of people that I've managed to work with, but who I've managed to learn a ton from. So just some thoughts for the trainees. The first step is always the hardest. And so really thinking about, taking that first step. What am I going to do with my career? Where do I want to go? Who can I reach out to? Am I comfortable making a call to a senior person? So the first step is always the hardest, and things hopefully will get easier after that. Good things take time. So things don't occur overnight. And I know we live in a society where we want instant gratification, but a lot of this stuff takes a long time, and it takes, work, especially if you're doing anything related to clinical research or you're trying to develop a new program, you're going to run into obstacles. And so trying not to quit when you run into those obstacles, but thinking of ways of going around, over, under, through to get to where you want to go. One thing I want people to think about, though, is that being busy does not equal being productive. And so though you can spend your days going through your emails and being busy, but is it really getting you to where you want to be with your career? And so thinking about every day, well, what am I doing today that's helping me advance my goals, my career goals, where I want to be in 6 months, a year? The other thing is you always have less control than you think. And I think we really learned this during the pandemic, but especially I think about this when I'm doing clinical research trials, things happen, things don't go the way you planned, your IRB doesn't get approved, something happens. And so you often have less control than you think, and just being okay with that and recognizing that and thinking of ways to plan for it. And then another thing I just want to say is don't look back, you're not going that way. And oftentimes we tend to be like, well, if I had done X, maybe B would have happened. If I had done C, I could have been here. We can't change any of that. So we can only go forward from where we are today. And so just thinking about how we see ourselves, how others see us, and oftentimes they're very different, right? We, and especially women, tend to downplay our attributes. There's data that shows that, women won't apply for a job till they're 120% qualified, whereas men apply for jobs when they have 50% of the qualification. And so I think how we see ourselves and how others see us is oftentimes different. And I thought of this as, Dr. Shaw's reading my introduction, and I'm like thinking, well, that person sounds pretty accomplished, but there are days where I don't think that of myself, right? I'm like, and so I think just remember that people see us often differently than we see ourselves. The other thing is, and I think we all get hung up on this, but your self-worth has to come from within. And so it's not how many articles you've published. It's not, how many grants you've got. In the end of the day, I think, you need that internal self-worth to really move forward and be successful. So perfection does not exist. And I often think, well, if I was going to say what's perfection, people think they're kids, like, oh, I have these kids, I adore them, I love them. Perfection, right? It doesn't exist, not even for your kids. And so we have to accept that, everything you do, there's going to be flaws to you. You're going to make mistakes. It's okay. And this is, you're only as good as those with whom you associate. And so really you want to think about that. Surround yourself with people who are positive, with people who are willing to support you, with people who believe in the same causes you believe in, and who are willing to work with you. And so again, I have to say I've been really fortunate over my career. And probably the reason I've stayed all these years is that I've been so fortunate to be surrounded by people who are smart, who are willing to help, who are willing to be supportive, who are willing to be, an ear when you're having a bad day. And recognize not everyone will support you. There are going to be people who are going to put roadblocks in your way. They're going to tell you can't do what you want. If it's something you believe in, you have to believe in it and push it forward. And then finally, fear is the number one source of regret. So don't be afraid to take risks. And, it's hard, right? Because, you can in your head put up all these ideas. Well, I can't do this person's not letting me do this. I'm afraid that if I do this, I'm going to fail. If I try to move to this new place, what if it doesn't work out? There are always options. You can always change things. So don't let being afraid of certain things hold you back from doing things that you really want to do. And so leadership is not about being the best, but leadership is really about making everyone better. And so being successful doesn't necessarily make you great. What makes you great is when you reach back and help someone else become great. And so I'm going to leave us with that today. And I really want to say thank you to Dr. Sethi and Dr. Shaw for inviting me, for Dr. Maynardi for being one of our best fellows. And it's so nice to have a connection here with people who I've known from the past. So I'll stop there, and I'm happy to take any questions. Anne. Oh.
Thank you for showing so many pictures of me. My question is, so I haven't done a ton of mentoring, but
I don't think so.
Hello? Okay. My question is, though I have not done a ton of mentoring, I think a lot of the focus of this excellent talk was on a mentee knowing what they want, and your job as the mentor is to figure out how to help them get it. But I think the mentees that sometimes I have met along the way don't know what they want. And you feel like your job as a mentor is to help them figure out what they want. Do you have any advice for that
Right.
part of the relationship?
Yeah, so you're right. Oftentimes people will come with you and this happens. I mean, it happens at all stages of career. So I just met with an associate professor who's kind of like, I've been doing all this for my career so far, but I'm not sure I'm really enjoying any of it. And I'm not sure but I'm also not sure what I want to do moving forward. And you also see it with, junior trainees, like, so residents will come to me, well, I want to do something in the ICU. Like, that's really broad, right? And so I think it's through conversation, right? Asking them, okay, well, can you narrow it down? And, what are the things you really enjoy? What are the things you hate about, what you do? And kind of asking questions and listening, right? And listening to what they're saying, and then pulling, and some of it ends up being a good listener, right? Listening to what they're saying and trying to pull out those pieces to help them kind of shape and talk through what they may want or what they may want to do. It's interesting because our new dean has just started and we're piloting it in pulmonary. I pushed for this, but she's starting this and everyone's going to have to fill this out on REDCap and it's going to go through the dean's office. But you have to fill out all like the stuff you kind of would for promotion and like what you've done over the past year. But part of it is what are your needs? What do you want to do moving forward, to constantly get people to think about, okay, well, and she's like, oftentimes what I find is junior people don't even know what to ask for. And so I think we need to figure out ways to teach people about what to ask for, or give them the resources to know what's available and say, okay, if you want to do X, you need these resources. And so I think a key thing is conversation and listening.
Thank you so much for being here. I thought that was really great and also really relevant. I think it's awesome to see people from other departments here too, because I think this is not just applicable to internal medicine or to Pulm Crit. I'm a general hospitalist, and I actually get to do a lot of the mentorship stuff with our residents. And one of the things I sort of struggled with when I took it over was the balance between having it be formalized and assigning somebody, but also making sure it's a good fit. So I think I've gone back and forth on that. And what we ended up doing is having sort of a wiggle room period of the first 6 months for them to change their mentors. Have you found anything formal on whether or not informal or formal mentorship programs work better? Is there any data on whether there's, a hybrid model, or it's just whether you have one at all, or whether it's better if somebody hands you somebody, or whether it's better if you find them on your own?
Yeah, so, I spent a lot of time looking at this data in preparation for this talk and in general for what I do. And the literature is all over the place because they haven't really looked at what's the outcome? So is the outcome the mentee satisfaction? The outcomes tend to be subjective, which isn't bad. Or should the outcomes be career progression? Is that what's important to us as institutional leaders, but is that really what's important to the mentee, or is their satisfaction more important? And so the outcomes are kind of all over the place. I think for the most part, the studies show that when there's formalized mentoring in place, at least there's somewhat accountability. So you're less likely to fall through the cracks than informal mentoring programs. But oftentimes people come upon people and they meet and they end up having great mentoring relationships. I think where people struggle is personalities don't match, or goals don't align. And so it's hard. And so it ends up being trial and error oftentimes. So I haven't come up with yet a good algorithm for the best way to figure out how to match people. It ends up being a lot of trial and error. But then what happens is that the good mentors get overburdened, right? Because then everybody wants to work with the good mentors. But the flip side of that is I think we can train everybody to be good mentors, right? It's not something we learn, right? People don't teach us how to mentor. It's not like in any school, like med school, business school. Maybe there is some literature out of psychology and sociology about this. And there's actually, and maybe we can extrapolate from this literature, but there's literature that then has used formalized mentoring programs, but in kids, like school. So if you're struggling in school and you have a mentor assigned. And so there's some literature in there which may be able to be converted over to medicine. It's a little bit different, but that's where there's a fair amount of literature.
Margaret, thank you for putting up pictures from days gone by that I remember people.
Well, Jamie, I couldn't find any of us from fellowship.
That was by design.
That was before there was like camera phones. Nothing was digital. We're
Right.
dating ourselves, but there was nothing digital.
Thank you for a wonderful talk. And you mentioned, you talked about the leaky pipeline and how there are 50% of graduates from med school are women and only 16% are deans, etc. And you spoke to some of your activities at Yale about the sponsorship and the RVU for metric for mentoring. Any other ways in which you think institutions should develop an internal formal mentorship program? Any ideas that you have that you could care to share today?
Well, I mean, I think, you know, I think it's tricky, right? I think it has to, I think there's not one size fits all, right? And so when you, and that's what you find when you look at the literature, like there's stuff, really specific stuff, like here's this mentoring program in our radiation oncology, you know, thing, or there's, you know, mentoring programs in surgery. And so I think institutionally, I think there needs to be support and recognition of the importance of mentorship and sponsorship and making sure people have access to it. And then, I mean, these are just my thoughts, but maybe, you know, maybe then individualizing it in each department, right? Because what, you know, may be important in surgery may be different than what's important in internal medicine, and doing it that way, but making sure that there's access. So we did, as part of my work as the faculty advisory council to the dean, we did this mentoring survey, and internal medicine kind of has this structure in place, although even with the structure in place, a fair number of people will report, I don't have a mentor or I don't have appropriate mentorship. But there are some departments in the university that have no mentorship at all. And so really trying to make sure that everybody has that same access and then individualizing it for each department may be the best way to go.
The annual review as an opportunity to do that?
Yeah, so we do.
Ask if people have mentors, do they need one, what they're looking for?
Yeah, so we absolutely do that. And, you know, again, what we find is like, so I said, like Erica Herzog was assigned as my mentor, right? I mean, you would never pick her to be my mentor. We do things that are totally different. But, you know, there was nobody else really in our department, I mean, to mentor me. And so, again, was that the most ideal? I mean, we made it work, but again, I think that ends up being, you know, how, you know, based on personalities and how willing people are to give you their time. So she would email me and text me and be like, all right, should we set up a mentoring meeting? I'm like, we can. I don't know if I have anything to tell you, but always at least checking in and making sure things were going okay. But I think, so we do use that annual report as a time. And so now these questions are on it. Do you have appropriate mentorship? What kinds of things do you need for your career advancement? Are, you know, you getting what you need? And so it'll be interesting because, like I said, we're just piloting this and the dean's office is collecting the data. So it'll be interesting to see what comes out of it.
There may be some questions on Zoom for you.
How do I know that?
Oh, no. I think so.
Slideshow?
Maybe, yeah. I don't see the link active.
Yeah.
Okay, right
Not
there.
there.
Oh, maybe it wasn't set up on Zoom. It's on there on the, oh, right, okay.
Yeah, so
I can't pull that up
Nothing in the chat.
in the chat. Oh,
All right. Well, I want to thank everyone for being here and giving me the opportunity to come speak with you all today. And I have to give a plug in for Dr. Sethe is an amazing cook. I felt like I was at a Michelin starred restaurant last night.
food. Just to give everybody notice that we're having luncheon seminar on women in medicine. So feel free to join even if you haven't RSVP'd. There may not be food and victuals enough for everybody, but you're welcome to come and participate. It's going to be in the POB. at noon.
Thank you.
I think this is the first time in the history of 6 years that I think pediatrics is here, surgery is here.